Not sure when to get your loved one assistance in the home? We're going to discuss that today. My name is Andrea Cohn. I'm a nurse practitioner with Medical Consulting and Management. The main recommendation that we give families about when to get your loved one assistance in the home is when things become unsafe. Safety issues can mean many different things. It can be driving when they're unsafe. It can be not recognizing their home, so wanting to get away from the home, be that walking away or driving away or calling someone to take them away. Unfortunately, during this process, many people will not recognize their home. We think that they flash back to their childhood home and they say, I want to go home, because there's so many instances of where they say they want to go home and they're either home or someone takes them back to their house from a facility and they still don't recognize it. So we're not sure what home means to some of these people, but even when you take them back, usually with the years that have passed, and even the siblings who have aged, they're not going to recognize the homestead and they won't recognize the siblings. I did have a patient who asked to go home. She wanted to see her brothers and sisters. Her husband took it for face value. He drove her out to Minnesota. And they got there, they got to the farmhouse, and her 80-something-year-old brothers and sisters were all there to greet her, and she looked at them. She had no idea who they were. She was thinking about them as children. And she ran right from the house, out the door, into another farmhouse down the street. She was so scared. So, take me home doesn't always mean what we think it means. If your loved one does not have dementia, but you've noticed some bruising, some cuts, things are in disarray in the house, and you're wondering, when do I get somebody in here? That's a very valid and good question also. We tell folks that if your loved one is falling, your loved one is showing up with unexplained injuries, you feel like their safety is compromised, as we talked about a little bit earlier, but maybe they're not locking the doors or leaving the doors open. Or in one case, I had somebody leave a key in the door. That's not safe, and it makes your loved one vulnerable. If their vulnerability gets to the point where they can also be taken advantage of, that's another issue. And we've had many scams or scam attempts with clients in our company. That is a big problem on this population. Medication compliance is another issue. Sometimes they get confused about their medication, they're not sure how to take it, so they're overtaking it or they're undertaking it. So overseeing the medication is a lot for families. Some are able to do it and some aren't. We have nurses who are capable of doing medication management. And once you get someone back on track, a lot of these issues may clear up. So that's where you want to have an assessment of the home, check the environment out. Is it safe? Are things locked up appropriately? Is there too much drinking going on? You know, sometimes people don't remember they had a glass of wine, so they have another one. And they don't remember they had a glass of wine, so they have another one. There's all these different types of issues that can happen. And I'm not opposed to drinking. However, in the elderly, there can be a problem with mixing that medication types they're on with the alcohol, which is where we grow concerned. So any of these issues where you feel your loved one is unsafe is when we think it's time to bring somebody in, maybe a few hours a day, and go from there to establish a trust and rapport and have some oversight into the home and what's going on with your loved one. In addition to safety concerns, we also want to make sure that your loved one is able to complete their activities of daily living safely and properly. I visited with a patient yesterday who hadn't had a shower in 21 days. You can imagine there's a little bit of an odor, and there's also a risk because it puts your skin at risk for yeast infections. It puts you at higher risk for UTIs and other type of skin breakdown that's avoidable. So it's very important to oversee your loved one's ADLs and make sure that while they may not be doing it 100%, they need to be at least doing 50% of what they need to be doing each and every day to prevent further issues and further health complications. This is where home health can come in again and help you manage the situation, maybe give you suggestions. In our company, if it's something we don't feel like we can handle, we will often bring in other resources. We're very connected in this area with other resources that can help with almost any type of situation. And in my own case, I was able to bring in 2 wonderful caregivers for my mother. They stayed 4 days a week and 3 days a week, and it allowed me to be the daughter and to be able to just really enjoy my mother. My brothers got to do the same thing because all the hard labor and the toileting and the showering, which I would be happy to do for my mother, it was just easier to go there and have tea and meals with her. And that's something else I want to mention back with the ADLs is that meal preparation and nutrition is very important in this equation. And so if your loved one is losing weight, that's another red flag that it's time to get some help. Sometimes you get them just on the right medication or make the right diet change, and it can really increase their quality of life by giving them strength and gives them just a better day overall. So these are just some tips to help you. If you'd like more information, please reach out to mcmhomehealth.com.